Miss Christine, thank you for joining us today. Could you start by telling us a bit about yourself?
Absolutely. I'm the CEO of ELSO, which is a global organization comprised of about 750 centers around the world, in 65 or more countries. And it's a huge honor to serve in this role.
As an ELSO leader, what are your thoughts about the progress that SWAAC chapter has made?
This chapter has actually done some amazing work. One thing I would note is bringing more people to the table. So as a leadership team, we can hear from all of the different, very different countries that are part of this chapter. And we have some amazing examples of well-resourced areas and the opposite. And to be able to bring those two perspectives together is incredibly powerful. Also, the group has done great work on their bylaws, which sounds boring, but this is how we determine who gets a seat at the table. And I've been really proud of the leadership, especially under Huda Al-Fudri. She's led a whole bylaws update that will bring more voices to the table, bring more young practitioners to the table as well, and make sure we have nice, diverse opinions. But more importantly, we're hearing from the centers around this chapter and how they're doing their work and what they need, from education and training to technology, systems, standards, policies. And these things also maybe sound boring, but they're the difference sometimes between, good patient outcomes. Because if your team is well organized, they know who's doing everything, they communicate well, and you've got a really nice set of policies and procedures, things work well when you've got urgent situations. And that's what you want. So you want a calm, well-practiced team that works well together, that knows what everyone's doing. So they've done amazing work, and really proud of the work that SWAAC also is doing.
And where do you think ELSO as an organization is heading in the future?
That's a great question. We started as this group of about 200 people global initially, because there were so few people. This is in 1989 when ELSO was founded. There were so few people that were doing ECMO, and it was still at that stage very much a pioneer's exercise, if you will. People were inventing their own technology. They were using their own technology in the field. And we've come a long way in 35 years to this, where we have 1,000 people plus with us today. But where we're going next is to try to make it easy for people to have access to resources, know how to do their work, and continue to collaborate and support each other. That's a really important part of the spirit of how we do our work. I hope you feel that too while you're here. People feel like family, because it's humbling work to take care of the world's sickest patients, and they're on life support. That's, the most sick patients. And so they're complicated, and we need teamwork to, make sure we support each other and do a great job with the patients. But where we're heading next is to help really solidify the education and training standards for programs. And again, just make it easy for people to do really complicated work, treating really sick patients.
If I can touch on something you just said about sort of education training, what sort of education training do you think, or what sort of skills do?
That's a great question. So we're kind of doing a layered approach. During the pandemic, there were a lot of places that wanted to do ECMO, and we weren't able to go out and work with teams the way we normally might. So we did, about 100 people globally came together to create the first global standard for foundational didactic knowledge. And that we made available virtually, so anyone anywhere can have access to it. And then same for simulation. That's more hands-on, competency-based learning, but that too achieved a global standard. And so the layers are the foundational education and training now has a good global standard, thanks to people from around the world struggling with what are the most important elements. So we used a Delphi process, which is just a way of saying, are we achieving consensus, yes or no, to create that. And now we'll start layering on top more programming for the adult foundations. Really helped with the kind of care that adults ECMO patients have, but we'll layer on neopeds, so our neonate, our smallest babies, the children, the pediatric children. And then on top of that, we'll get to more specific things like a focus on cannulations, which is how you put patients on ECMO, which is usually done by a unique group in and of itself, surgeons or interventional cardiologists, emergency medicine. And then ECPR is kind of our upper echelon of education and training, because that's more for patients in the field that have suffered an MI of some kind and would benefit from ECMO. But they're challenging because minutes matter. And so you want a very well-trained, good communication team to do that work. So those are the layers of how we're trying to build education and training. And it's going, I think, really nicely. People are involved from around the world. That helps. But then we're setting centers around the world as our endorsed courses. So you can see on a map on our website where we have endorsed courses. There's almost 30 around the world right now, and we'd like to grow more. That's part of our strategy to make sure there's high quality care available everywhere.
And what role does the international collaboration play in advancing ECMO care, and how can ECMO centers share knowledge globally? Shun it a little bit.
So there's many ways that we talk with each other, but we really started globally, and it's important to us to be a global organization. We know great ideas come from everywhere, and this is an activity where we need the voices of everybody to be heard and help us advance to the next level of solving really complicated issues. There's bench work that needs to be done still, like really figuring out which molecules and how to make things like the blood going through a circuit not stick and cause the kinds of complications that come from that. So that's like a whole lane of work. And then just looking at the circuit technology is another lane of work, and how teams work better together is another. There's many layers to this. So we need ideas from everywhere around the world, and how we talk to each other is a good question that I wanted to spend a minute on. Also inspired by the pandemic was more instant communication. So we set up some WhatsApp channels so people could talk in real time about a challenging case that they have, or how do you do this, or how are you handling this kind of a shortage. And we have 11 of those at the moment, where anybody from anywhere can send a message out, and many people will respond in real time with their best advice. And sometimes it's a publication they may not know about, or their own, how they do things at their hospital. And so it really fosters global engagement and communication. And that's important, as is this. Being here for this conference, there's a great plethora of exchange of ideas or excitement or support, and just this relationship building that we do over time. Everywhere I go anyway, it's a bunch of old friends and new friends every time you go, with people that are trying to do this really complicated kind of work. So it's incredibly rewarding, but really important to be globally accessible.